health issues, it always used to be focused on the physical health. But definitely now we are seeing a change in that. We are seeing how mental health is slowly becoming part of the mainstream discussion. And everywhere uh, it is being discussed, it is being spoken about. And in today's world, especially where there's been so much advancement of information that we can get, we can receive, and so much of changes are rapidly taking place in society. I think the levels of stress that people are undergoing also has increased, and people are being put under a lot of stress and a lot of pressure, and I think that is leading to more and more issues that are coming out. And as education is improving, as living standards are improving, as lifestyles are improving, I think at the same time we are seeing that these issues concerning our status of our mental health is also changing a lot. And we are seeing that many people at a younger age also are getting into stressful situations due to so many reasons. I think the topic today is how the new digital world is affecting the present environment. And that is, of course, we are all seeing, because we are seeing our children, we are seeing our grandchildren, and we are seeing what is happening in their own, lives. And I think definitely these issues need to be discussed openly. And in Karnataka, we have always been a very progressive state. I would say that not only Karnataka, I think all southern states are very progressive states. Not to have any sort of panga with our person here, but southern states have always been, always looking at improving, and being more open-minded about issues and quality of health, education. If you look at the overall parameters, there's no competition as such, but definitely southern states have really been in many sectors the models for the country, doing very well. It's not that we are the only ones, but we as a unit, when we talk about the southern states, we are open-minded, we are progressive, and Karnataka has been a leading figure. I think Dr. Pratima Murthy also is here, and maybe due to the presence of NIMHANS and for whatever reasons, but mental health has become a major issue for us in Karnataka. Even in our health department, our medical education department, in every sector, we are looking at mental health in a big way. And we've got district mental health programs, state mental health programs. We've taken, many new programs have been launched in Karnataka, where along with the support of NIMHANS, we've got the brain health initiative, where at the district level, we've got trained psychiatrists, psychologists, therapists working, and we've got mental health programs being taken down to the taluka level also. So of course telemanagement facilities and so many other things are being done. And of course we need to do much more. We need to bring about more awareness, because I think many people don't even know that they are having a mental health issue, and even if they know, they don't want to talk about it. So, and especially even in among younger people, even in schools, I think we need to expand this, where children also are exposed to a lot of stress, and adolescent children are exposed to a lot of stress. So we see more suicides, we see more depressions happening, we see more substance abuse happening, we see people getting paranoid, or people having psychological stress, psychotic behavior, all these things are happening. And that is because whole environment is, if they don't get the right support, many people are not able to cope. The competition, the urge to move ahead, the peer pressure, all these are combining. So we need to really work at a holistic way. And of course, just now, I think Mr. Jagdish was mentioning, Dr. Jagdish was mentioning that there are certain things that government has to look at in terms of policies and our laws, how we can improve things. And definitely we are open. Whatever suggestions that the Indian Psychiatric Society will give to our government, definitely we'll look at it with a very open mind, and see how we can bring about changes in policy, bring about changes in legislation, and see how we can create a more enabling environment for professionals to work and also for people to be able to access, the available redressal, advisors and systems. So we need to work together, and we are, I'm sure, as far as Karnataka goes, that we can talk about. But we will do whatever we can, and hopefully ultimately our aim is what, if a person is physically impaired, definitely he cannot fulfill his complete ambitions and whatever he wants to do in life. Similarly, anyone who is mentally impaired will not be able to work to his optimum level to be able to achieve whatever he can achieve. So to have a healthier society, we need to solve these problems and work at it systematically. And for that to happen, I think professionals like you who are having a profound impact, I think people's lives are saved, families are saved by the intervention that you people do. It has brought about tremendous change in them by getting the right advice. So I think your work is very important, and we recognize that, and we are with you, and I am sure that this conference will be a good success.
If you like this video, ಬೇಗ ಲೈಕ್ ಮಾಡಿ, ಕಾಮೆಂಟ್ ಮಾಡಿ, ಶೇರ್ ಮಾಡಿ ಹಾಗೂ ಯೋಯೋ ಟಿವಿ ಕನ್ನಡವನ್ನು ಸಬ್ಸ್ಕ್ರೈಬ್ ಮಾಡಿ.